Good day everyone, especially to Ma'am Loida Labis. Good day ma'am. My assigned report is about the continuation in other protozoan infections. First is the gapeworm. A gapeworm, also known as a redworm or forkworm. Forkworm, is a parasitic nematode worm that infects the trachea of certain birds. It can be found also in the lungs of infested birds. The disease caused by the gapeworm called gapes, which may manifest as difficulty breathing with an open beak, and cyanosis. Cyanosis is a bluish discoloration of the skin resulting from poor circulation or inadequate oxygenation of the blood, and this may lead to death. The infection of the gapeworm is frequent in outdoor reared animals, for example is birds and chicken. Next is tapeworms. Cystoda is a class of parasitic worms and flatworm phylum. Most of the species and the best known are those in the subclass Cystoda. They are ribbon-like worms as adults, known as tapeworms. There are many species of tapeworms may be found in the chicken. Examples of the species is Rallietena species and Proglutina. This can be found in the small intestine, most frequently associated with clinical disease. Next are the ectoparasites. Ectoparasites are organisms that live on the skin of a host from which they derive their sustenance. Means that ectoparasites obtain their food and drink on the animals, and after that the animals get infection. The ectoparasites are scaly leg mite, red mite, and other skin mites, ticks, and fleas. First is the scaly leg mite. These are common microscopic parasites that burrow. Burrow means make a hole or tunnel, and this live within skin of the bird's feet and legs. When the animals had scaly leg mites, this can cause raised scales, in which the skin of the birds slowly loses. Crusting also refers the skin to form into hard, and distortion of the skin. The skin of the birds will not look like normal skin on birds. It had bad changes. When this happens, this can lead to malformation, a deformity, and abnormally form of the bird's feet and legs. Lameness, when chicken become lame or injury in the feet and legs because of the scaly leg mite, and it can cause infection of infected tissue. The scaly leg mite can be transmitted by direct contact with infected birds. To treat the birds that had scaly leg mite, the scales must have softening, regular washing so that the feet and legs will be clean, and by using suffocate in order to kill the mites. Example of suffocate is paraffin jelly, paraffin, mineral oil, or an insecticide. Red mite and other skin mites. This is visible to the naked eye and fast moving on the skin of the bird. They suck the blood of the birds and can lead to irritation when the chicken feel irritated or being annoyed. Also severe blood losses because mites suck the blood of the birds that affects the overall conditions of the birds. The red poultry mite, Dermanisus galinae, lives in the housing environment, largely feeds on birds at night, while Ornithonisus sylviarum and Ornithonisus bursa, other main species of mites that live on the chicken but feed during day and night. In order to control the mites, we can use insecticides or throw for fumigation of houses. Fumigation means the action or process of disinfecting or purifying an area with the fumes or certain chemicals so that the mites will disappear or will go away. Next is the ticks. Ticks are parasitic arachnids that are part of the mites superorder Parasitiformes. Ticks are also blood-sucking parasites that can be found in the skin, particularly areas with little or no feather cover, such as the face and under wings. When animals have ticks, it can lose condition and reduce productivity. The skin, comb, and wattles may become pale due to blood loss, and red spots may be seen on the skin. The main species of the ticks is the fowl tick, Argus persicus. Though chickens may host other species normally associated with mammals, including sheep and cattle ticks. Ticks feed at night, living in cracks and crevices of housing in the day. Crevices is a narrow opening or fissure, especially in a rock or wall. To control the ticks in housing, we can use insecticides. Fleas, small flightless insects that survive as external parasites of mammals and birds. The stick-tight, fast flea is commonly found in warm climates. Fleas are often visible in clusters or group of fleas attached to the skin, typically around the eyes, on the face, comb, or in the hair and wattles. Adult fleas feed on blood and stay firmly attached to the bird, while eggs and nymphs remain in the surrounding environment. Eggs and nymphs will become fleas in a few days. When birds had fleas, this can lead also to irritation and blood loss, leading to poor condition. This can lead to death, especially in young birds that had fleas because of anemia. Anemia because of blood loss. This is a condition marked by a deficiency of red blood cells or of hemoglobin in the blood. Clusters of female fleas can be seen attached to the featherless skin around the eyes, wattle, and face. Fleas should not be physically removed but treated with Vaseline or paraffin. Chewing lice are small, rapidly moving, yellow-brown parasites which can be found over the entire skin and feathers of the bird. Species commonly found include Minacanthus stramineus, Minacanthus cornutus, Menopin galeni, Goniodis gigas, and Goniocotis galeni. Lice are transmitted mainly through direct contact between birds. Through heavy infestations and overcrowding can lead to transmission via sherd. Overcrowding means having not enough space. Infested bedding, where the birds lay and roost, a place where birds regularly settle or congregate to rest at night. Birds can usually tolerate mild, also can lead to anemia through blood loss and lead to lost productivity when being attacked by the fleas. Infestations also lead to local skin irritation and damage. We must have strict sanitation, avoiding overcrowded housing, providing dash or ash baths for the birds, as well keeping roosting areas, nest bedding, and litter clean to treat lice. Insecticidal treatments and powders licensed for the treatment of mice can be used under the guidance of a veterinary or poultry specialist. The first picture is there is clusters of lice seen infesting the vent area of a hen. The vent is a small opening on a chicken's fluffy butt that functions as both our reproductive opening and an excremental escape hatch. The next picture is the feather and skin damage typical of lice infestation. Fungal infections and mycotoxins. Aspergillosis, respiratory infection caused by various species of Aspergillus. Inhalation of spores, usually coupled with poor flock management, called high ammonia, excessively dusty housing, may lead to granulomatous lesions in trachea, lungs, or air sacs, more frequent in chicks, called broader pneumonia. Candidiasis, infection of crop, oral cavity, or esophagus with species of Candida, most frequently Candida albicans. This leads to mycosis or thrush. This is common in younger birds, most frequently occurs following antimicrobial therapy. Phoebus, ringworm, whitecomb, dry, scaly, and often lesions on unfeathered skin, comb, wattle, legs, caused by dermatophytic fungi, most commonly Trichophyton species. Last is the mycotoxicosis. This is caused by ingesting fungal toxins. Found in feed or litter are called toxins. Found in feed or litter are called mycotoxicosis. Growth of fungi may take place on grain used for food, or more frequently during storage of grain or processed feeds. Avoiding contaminated grain and good storage conditions for grain and feed. Dry and cold reduce risk. Mycotoxins can both directly affect the health of birds or lead to increased susceptibility to common infections. In general, the effects of toxins are more pronounced in younger birds. Mycotoxins may also accumulate in muscle and in eggs, which can enter the food chain and pose a risk to human health, notably increased risk of liver cancer. This would be the end of my topic. Thank you.